Twirla has an important update. The same contraceptive patch now has an updated label. This change reflects a more precise way of describing hormone delivery for transdermal contraception. It is important to know that this is a labeled strength update only. There are no changes to the formulation, manufacturing process, dosing, or clinical profile of Twirla. What has changed? The prior labeled strength has changed from 120 micrograms to 40 micrograms of levonorgestrel per day, and from 30 micrograms to 10 micrograms of ethinyl estradiol per day. Twirla continues to be the lowest dose of estrogen exposure in a combined hormonal birth control patch. This update follows FDA recommendations for how transdermal delivery systems should determine labeled strength. So why the change?
Historically, labeled strengths of transdermal patches were determined by manufacturers and approved by the FDA in ways that didn't always reflect actual drug absorption, leading to inconsistencies across products.
The steady-state serum concentrations of ethinyl estradiol were approximately 40 picograms per milliliter with Twirla. This serum concentration was comparable to a 30 microgram dose of ethinyl estradiol in an oral contraceptive pill. As a result, the initial Twirla label was 30 micrograms of ethinyl estradiol per day. The updated labeled strength is now determined by residual drug analysis, measuring what remains in the patch and on the skin after 7 days of wear, and calculating the amount actually delivered. The product is unchanged. The formulation, potency, and wear experience are unchanged. Contraceptive efficacy, safety profile, and pharmacokinetic data are all based on the same existing clinical evidence. There is no change to the composition or manufacturing process of Twirla. Continue watching for full indication and important safety information, including boxed warnings. Twirla is indicated for use in women of reproductive potential with a BMI less than 30 for whom a combined hormonal contraceptive is appropriate. Limitations of use. Consider the reduced effectiveness of Twirla in women with a BMI of 25 to less than 30 before prescribing. Twirla is contraindicated in women with a BMI of 30 or more. Twirla is contraindicated in women over 35 years old who smoke. Important safety information. Cigarette smoking increases the risk of serious cardiovascular events from combined hormonal contraceptive use. Women with a BMI of 30 or more have reduced effectiveness and may have a higher risk for venous thromboembolic events. Continue watching for additional important safety information.